So the Blackfoot First Nation tribes of Siksika, the Pekuni, and the Kainai, the Stoney Dakota First Nation tribes of Chiniki, Bearspaw, and Wesley, and the Tsuut'ina First Nation. Calgary, or Mohkinstsis, is also home to the Northwest Métis and the Métis Nation of Alberta Region 3. So this is me. You heard my bio. So it kind of astounds me that I've been in practice for 25 years. So I'm in my 5th year, and I started in orthopedics. And then in 2003, I did a year-long medical acupuncture course, and I started with pelvic health. And so that has really sort of affected, both things have affected my practice in terms of how I approach people and looking at a person physically, mentally, and emotionally from a little bit of a broader perspective. And that, of course, helped a lot with persistent pain and chronic disease management at the pain center. So I'm currently in private practice. I teach some courses at the Myofascial Yoga Institute. So I teach yoga instructors about pain science, a little bit about trauma-informed spaces, and pelvic health, of course. So, oh yes, and I'm a yoga therapist now. So for anyone who has never been to physiotherapy, we will start looking at everybody in the same way. So we are mostly concerned with safe movement, effective movement, function, and preventing injury. So when you first come to a physio, we look at how you move, how you're standing, and really look at orthopedics as your framework. So your bones, your joints, your ligaments, how that's affecting your nerves and your muscles in terms of how your body chooses to move through the world in space. Pelvic health really looks at the bottom part of this picture. So it's looking at that heart-shaped bone on the bottom, which is actually a ring. If I hold my pelvis up like this, it's actually a ring on the bottom and on the top. So this pelvic ring forms the foundation of what we consider the foundation of your body. So everything sort of comes from and hangs off of your pelvis structurally. So when we look at stability, we start with your joints, joint surfaces, how everything fits together. Then on top of that are your ligaments. So the ligaments are like guy wires that kind of limit movement between so that your joints don't go too far. And then the next layer is essentially our muscles. And so the muscles are what in this paradigm are what we call your core. Thank you, some people, for leaving your camera on because it's nice to have somebody to look at. So when a physio talks about core, we are talking about a very specific container made out of muscle. So your diaphragm is that big upside down bowl on the top of the container. Your pelvic floor is on the bottom. And then the walls of that container are your deep belly and back muscles. So if you're not interested in the anatomy, you don't have to remember this, but it's essentially transverse abdominis is your belly muscle and multifidus is your deep back muscle. So those muscles together form what we consider your core. What's important about this container is not because it's dynamic, because it's soft tissue, we want all of these muscles to not only be strong and flexible, but mostly adaptable. So it's less about just strength or weakness and more about adaptability. Every time your diaphragm goes up and down, as you breathe in and out, the pressure changes within that container. And within that container are your stomach, your liver, your kidneys, your large intestine, your small intestine, and all your pelvic organs. And so even just with whoever takes space within that container, we need a certain amount of space in order for all of those organs to be efficient and be able to do their job effectively. When we have length within this container, we also have maximum efficiency of space between joints. So this is getting into posture, if you know where I'm going with this. Efficiency of space within joints, efficiency of fluid flow, whether it's nerve conduction, whether it's fluid within vessels, arteries and veins, things like that. So maintaining the length within this container becomes really important when we consider movement. Okay, this is one of my favorite teenager pictures. So when I think about the container as a pop can or a container or a canister, we like to tell people to think about your pop can nice and solid, unopened like this, and not crushed. So you imagine when your pop can is closed, it's very hard for me to impact it. When it's open, so when there is a something within the system that is compromised, then we get that crushing happening. So one of the things that people tend to remember is just keep your pop can tall and don't crush it. So then we have space for all your organs and much less pressure downwards on your pelvic floor. So posture protects your pelvic floor. So not just about spinal length and head over torso over pelvis, but that space between your lower ribs and your pelvis. So if I'm to put my hands on my waist right now, like that, there should be a fair amount of space between the top of my pelvis and my lower rib cage, and I'm not squished down, right? And that's kind of like, we want that to be symmetrical, of course, but there should be a fair amount of space between those two areas. And if there isn't, you can do a subtle lift of your rib cage up towards the ceiling. Okay, so not actually into extension, but straight up. So when we look at neutral posture or neutral pelvis, when we're looking at approaching exercise, either standing in a static position, one of the easiest things to think about is your pelvis is kind of a bucket filled with water bobbing in the ocean, right? So we want that bucket filled with water not to spill too far forward or too far back, right? So there are a lot of ways of describing neutral pelvis and where we kind of want to be. I tend to tell people just to soften their knees a little bit. Think about length through your body, so rib cage away from pelvis, and just really think about your bucket not falling forward or back. So rib cage is over pelvis and then gentle space between the two. Okay, so this area, I find this absolutely fascinating. So this is kind of my area of interest, but the muscles in your pelvic floor have both fast twitch and slow twitch fibers. And it's a really cool thing because it has so many different jobs. So the postural aspect of your pelvic floor really speaks to the container, right? So there has to be a certain amount of tension or tone there for it to be a part of that dynamic system, right? The power part of it are those muscles that do opening and closing to actually control things going in and control things going out and allow pain-free activity in those orifices, okay? So posture is slow twitch, power is fast twitch fibers. This picture is essentially somebody, a male, lying on their back, facing with their head away from us. This one's female and that one's male. So generally they look very, very similar. There's always going to be those big muscles that attach to your pubic bone, kind of like a U shape that we call your levator ani. Levator ani is actually 3 different muscles. It's a combination, but they're kind of like this, like a U. And so those muscles, not only when they squeeze, they kind of lift up a little bit, but they also squeeze a little bit forward. So there are a number of ways to activate certain parts of your muscles if we wanted to be specific. Okay, and that becomes important if we have specific symptoms like bladder issues but not bowel issues, or bowel issues and not bladder issues, or if it's in some way associated with pain, then we can be a little bit more specific about how we activate our muscles. People have often heard of Kegel. So Dr. Arnold Kegel was a physician, and it was his wonderful idea in the 50s to strengthen these muscles to prevent bladder incontinence for women who had babies. So pelvic floor muscles have come to kind of bear his name. Since the idea of Kegel's came around, we've become a little bit more specific in terms of how we activate and how we use our pelvic floor muscles. So, oh, I want to show you one more thing. So this is like this. And then if I take my beautiful human and cut them down the middle and then look into her pelvis, it looks a little bit same, but a little bit different. Oops, not good light. So what I want you to notice with that, even though it's not very obvious, the muscles will look slightly different when you look this way versus this way. And the reason for that is that there are at least 2 or 3 functional layers. So when you look from the top, it doesn't look exactly the same as the bottom. The bottom ones that we see are fairly superficial muscles, and they do this open and close, and so they won't actually go as deep as the other ones. Okay. So it is up to you if everybody wants to stay sitting, but we're going to do a little bit of practice. So if you are sitting, you can put your feet, you can sit cross-legged or put your feet on the floor. Just make sure that you can actually feel your sit bones underneath you. If you can't feel your sit bones, you can gently, this is a yoga trick, gently slide the flesh away. So grab underneath and kind of slide the flesh away so your bones are actually on something. So what we need to do first, anytime we want to access pelvic floor, is we have to orient our minds to where we are. The pelvic floor is one of these areas of our bodies that we don't see often, we don't think about often, even with toileting. Oftentimes people will just sit on the toilet and pee or push and not think about actually what's happening at your muscles. And that's okay. It's just ignoring a part of our body that is actually very important to our daily function. So we want your muscles when you're toileting to be able to relax and open and not necessarily strain or push or bear down and ignore what those muscles are able to do. Okay, so if you are sitting, just wiggle around a little bit so you can feel yourself on your sit bones. And then gently imagine somebody is lifting your head and your rib cage up towards the ceiling. So you have a little bit of length and a little bit of pressure away from your pelvic floor. Okay. When I start to do any sort of pelvic floor training, I always start with this awareness first. So sometimes it's just awareness of your body in space. It's just straight up mindfulness to see where your muscles are, where your bones are, because your muscles are just between your sit bones, your tailbone, and your pubic bone. Okay, so sit bones are here, tailbone is here, and pubic bone is here. Oftentimes when people activate their muscles, they end up doing a little bit more than they need to. So you activate your inner thighs or your glute muscles or something else that isn't actually just that diamond shape. So when we want to isolate and activate your pelvic floor, it's just those muscles in that diamond shape. Okay, so we do endurance or awareness first to see that we can activate those muscles effectively. Then we look at how long somebody can hold those muscles. So it's activating and then holding for a certain amount of time. 10 seconds is a good goal to start with. And then we do the quick ones. So it's the ability of a muscle to go on, off, quickly. So not necessarily the repetition, but to be able to quickly get a contraction and then quickly release it. Okay, so visualize your pelvic floor if you can. Your hands can go anywhere. When we do any sort of exercises with your pelvic floor, we try not to hold your breath. It's just like with exercise, with any weighted exercise. Anytime you hold your breath, the tendency is for us to go and do a Valsalva maneuver and push down on your pelvic floor, and we don't want that. So it's even more difficult to kind of feel what's happening at your muscles if you're holding your breath, and to make sure that we're isolating. So we want to stay breathing. When we start this, sometimes I'll have people put their hands on their belly and then one on your bum. So one on the side of your bum and one on your belly. And then we try to think about, so one of the things that people tend to start with is imagine you have to go pee, and we're just contracting the muscles to hold your pee in until you get to the bathroom. That's one that a lot of people tend to use, which is completely okay to use. What you want to do when you activate that muscle, so I activate that muscle and make sure the muscles underneath my hands, so under my belly and or at my belly and at my bum are nice and soft, so they're not squishing or tightening, and your inner thighs actually also stay really soft. Then release and make sure you're breathing the whole time. The other thing that we want to try is contract, relax, and see if you can actually feel the difference between that tightening and that relaxing. Seeing if you can actually feel softening after the contraction and if it feels the same as when you started. So we want to make sure you contract, tighten, relax, and you're starting off at the same tone that you began with, or you're ending with the same tone that you started with. Okay. One thing that we like people not to do, if it's an option, is try not to practice this exercise when you're on the toilet or actually when you're in the bathroom. And one of the reasons for that is that your bladder is very easily trained and very easily convinced to what is normal. And so we would love for your muscles to be able to contract and relax outside of being on the toilet, because when you're on the toilet, we really want your muscles to just relax and not think about tightening and holding things in. So we will tell people, if you really need to see what you're doing, you can hold your pee like midstream one time, but only once in a week. Otherwise, we try to do it in other environments, so it's not always in the bathroom. Okay. So I wrote down a whole bunch of different cues. There's tons of cues that you can use. And so there's some for humans with a vagina, some with humans with a scrotum, and then some gender neutral. So we're just going to practice a few of those now, okay? When we're teaching pelvic floor, I don't always do the same breathing pattern with everyone. So I will often suggest take a breath in, contract, and then exhale. I will often start there, but that said, it doesn't always work for everybody, right? So some people actually have more isolation when they contract on the inhale, some is more on the exhale. Eventually, when we are talking about transferring this activity and knowledge to a strength-based program, so when we're actually starting to go into strength training and things like that, because we want people to exhale on effort, right? So if I have weights in my hand, I go, I really encourage people to do the contraction on the exhale. That's it. We start where we start, right? Every body is different, every mind is different, so we can just start where we start. So if you are female, you can stay in this position, make sure you can feel your sit bones underneath you. You can either stay here or you can try lying down, okay? All we're doing is changing your body's awareness of biofeedback. So when you're sitting, you have something underneath you to kind of, so you know your sit bones can feel something. Lying down is also a beginning position because we're actually taking away gravity. So both of those two are starting positions, they're just slightly different. So if you're a female, let's try with the breathing. So gently take a breath in and imagine you're squeezing around a tampon, and then hold that as you exhale. And then release. Okay, we can try again. So take a breath in. As you start your exhale, squeeze around a tampon. And then hold that. And then release. We're going to try all of these while we're here, because I have you here. So the other one that people like is either sitting or lying down. Imagine, so the muscles in the front do this. It's kind of like a little bit of a pinch. So if we think about gently pinching a grape and then lifting it up. So you're actually doing this, pinch and then lift up. When you're doing the lift up, your belly should stay relatively soft and your inner thighs should also stay soft. We'll get back to that in a sec. So take a breath in, start your exhale, squeeze your grape and lift right up into your rib cage. And then when you're ready, so everyone's still breathing, relax as if you're kind of dropping that grape back down on the seat underneath you. If you find another cue that works for you, that is okay. There's so many different cues out there. We just want to make sure that you can activate the right muscle, not co-activate your adductors, so your inner thighs, your bum muscles, or strongly at your belly, and that you can feel the relaxation fully after. Okay, so let's try elevator doors. So imagine the doors that do this, they're open right at your sit bones. And then all I'm doing is gently bringing those doors together, touching in the middle, hold, and then release out. So it's a very slow activation, touch, and then release. Okay, So another one that we do sometimes is a zipper, either front to back or back to front. What you will notice is when you're teaching a class or when you're trying it on your own, there is no consistency in terms of which one's harder and which one's easier. So some people might be quite strong posteriorly and some people might be quite strong anteriorly, and then the opposite is weak. So what I've discovered is that although we have guidelines, everyone really responds differently. So certain cues will work, and I don't make assumptions about which part is stronger than the other. So if we try front to back, imagine that I'm first doing a little bit of a pinch, then I squeeze around a big part. So imagine that's kind of like a pear. So I pinch the top part of the pear, squeeze the middle part of the pear, and then I squeeze that anus. And then I let them all go. Okay, so it's really kind of zipping up from front to back. So top part of the pear, big part of the pear, and then anus. Everything is lifting up, and then relax and drop. One thing that happens with people sometimes is that they either hold too long and other muscles come in, or they try to hold too strongly right away, and then other muscles come in right away. Okay, so isolation actually feels quite gentle when we first start doing these exercises. So back to front, if I squeeze anus and the big part of the pear, if you're female, if you're male, then we just think about pinch. So squeeze, pear if it's there, and then pinch at the front. And then relax. So in a perfect world, everything else was relaxed. You're still breathing. You're breathing smooth and not holding your breath at any point. So if you are male, this is not my normal language. I always start by saying that, but there's the cue that a lot of people respond to, which is nuts to guts. So if you think about my pelvic floor, my anus is at the back, and then base of penis and scrotum are at the front. If I think about the muscles at the base of my penis, if I'm grabbing the top of my scrotum and pulling my testicles up into my ribcage, right? So I go pinch and then pull my testicles up. So that's the nuts to guts cue. And that tends to work with men very well. And then I relax and I lay my testicles back down on the surface that I'm sitting on. Okay, so that's one. The other one that you will see and hear about is in order to activate your pelvic floor, you can start by squeezing your anus. And that kind of gives you a sense of one part of your pelvic floor to start with. What's important is that if you have bladder issues, it would be nice to get a pelvic physio assessment just to see kind of where your muscles are starting at, but especially after any sort of surgery, after post-prostatectomy, a TURP, any sort of like vasectomy, anything like that, where it's a surgery that's kind of focused on the front, you don't want to use that anus cue as your starting point. So what I would do is actually start with the nuts to guts cue, because we don't want to strengthen something that's already strong. Yeah, or already has kind of an established activity and pattern. Any questions about any of that? Okay, quiet group, that's great. Okay, so the other thing that I do when I start with this kind of thing is actually play with hip position. So once we can do it in sitting, and then we can do it in lying too. Once I'm in lying, I get people to practice with their knees together and knees apart. Because your muscles, we can activate them kind of within this range, but as soon as we move your hips around, it can feel like a different kind of challenge, right? So if I'm lying down, I practice knees together. I do the same thing, whatever cue works for you, contracting and relaxing, and then I try with my knees apart. Then if you want to get fancy, before we actually putting you into standing, I can actually practice with both legs to one side, both legs to the other side. Because once we start practicing with asymmetry, where you have to do one side a little bit different than the other, then we're actually getting into a lot of good training. Okay? Okay. So as we know, this container Your diaphragm is on the top, your pelvic floor is on the bottom, and your belly and back muscles are all the way around. So this image is from Julie Weeb's website, and I have her website at the end of this program. So Julie Weeb is a physio, and she does a lot of work with pelvic health and runners, especially postpartum. She has some great videos with understanding this concept, and she uses a lot of, she calls it the piston. She uses a lot of visual aids and things. So she's got great, I think she just calls them vlogs, her video blogs. So when we look at this container, I kind of transfer this container to her balloon. So it's kind of a closed system that is adapting to pressure changes. Okay, so your diaphragm's on the top, pelvic floor is on the bottom. The way she has her balloon right now, the person is facing that away, like that away. So that belly is here and back is here, but it's the same thing. So if you imagine this container, let's say I have somebody whose pelvic floor is not behaving and it is more towards weakness, right? So let's say it's extended and a little bit lengthier, right? So softer. And then somebody does a lot of squishing on the top, so like this, or squishing through the middle. You can imagine what would happen is a lot of the pressure would actually go downwards, right? So this is when we look at things like abdominal exercises, especially when we're looking at crunches. We want to really keep people nice and long and not necessarily just do a bracing. So if we are looking at exercise and protecting your pelvic floor, we will wait until somebody is really has enough strength at their pelvic floor to adapt to these changes before we add a lot of twisting or crunching, okay, which is what we call bracing. Fair? The other part to this that I wanted to mention is that breath, because your diaphragm is on the top, breath and movement through your rib cage becomes very, very important. Because if we have stiffness through your rib cage, then that ability to expand, and your diaphragm is such a big muscle and it plays so much of a role in this in terms of creating that release of pressure or the negative pressure in that area to protect your pelvic floor. If we are not allowing our diaphragm to expand enough, that is also creating more pressure downwards. So especially with anything like yoga or Pilates, we do a lot of lengthening to kind of keep that space, but also a lot of expansion kind of through rib cage, inside bending and rotation. And especially with an exercise program, it's the stretching after, right? And posture during, that when we actually manage your breath work and your diaphragm and rib cage mobility, you're actually protecting your pelvic floor. Okay. Okay. The other thing that I really wanted to mention here is there's some of you may have heard of this, some of you may not have, but polyvagal theory is becoming more and more within conversations when creating safe spaces. And these are all right off my shelf beside me. So Dr. Stephen Porges is the scientist that first came up with polyvagal theory. And so he wrote a book, and then he combined with Deb Dana, who's a social worker and a clinical therapist, and they wrote clinical applications. And then this one is Deb Dana's book, The Polyvagal Theory and Therapy. The one on the bottom, Befriending Your Nervous System, is the one that I often recommend for my clients or my patients. And I actually listen to the audio version because she walks you through a number of different exercises. So when we talk about trauma, we are looking at, Dr. Porges came up with a word called neuroception, which is just your brain, your mind, and your nervous system's impression of your environment. So it's looking at, so your brain is working all the time to figure out if a situation is dangerous or safe. Yeah. And so your neuroception is that awareness of figuring that out. So every few seconds, your brain is going, am I safe? Am I threatened? Am I safe? Am I threatened? All the time. So what this theory looks at is, Deb Dana calls it story follows state. And so your body's impression of your environment or interpretation of your environment will depend on your brain's perspective. Okay. So what this is going to is this whole idea of sympathetic versus parasympathetic. So I won't get into this too much, but basically when we are in a fight or flight state, so your sympathetic state, you're in survival mode. And a lot of that will happen if you are in pain, that system gets triggered. If you are worried, if you are stressed, if there is something in your environment that will somehow trigger a memory of any sort of traumatic event or memory or experience. Okay. And the reason I'm mentioning this is that when you are in that sympathetic state, it is very difficult for your body to spend energy into healing, recovery, and learning. And so mindfulness in that sympathetic state becomes very difficult. And pelvic floor awareness, pelvic floor strengthening, and moving your body safely through space relies a lot of that mindful awareness of where your body is in space. Okay, so that's why I mentioned this. I love befriending your nervous system is something that people can do on their own. It's almost like a bit of a workshop. Accessing the healing power of the vagus nerve has specific exercises in it for when you are in that sympathetic state to try to bring you back down. One of the easiest things to do in a class or if you're exercising to bring yourself kind of back into a relaxed parasympathetic state. Every person is different, of course, but one thing that we can play with that is very accessible is breath. So even if it's a matter of noticing, if I check in with my body and I notice that my breathing is fast or shallow, that's one thing that I can change right away. And it may take a few minutes, a few seconds, just kind of bring your whole system down a little bit. So that is a whole, we can spend hours talking about that, but it's a really important thing to be aware of, because when you have been through something difficult, when you are dealing with chronic disease, when you're dealing with some unknowns, it's not unusual for your body to get into that state, especially if you're in an environment that's new, an environment that you feel like you need to put effort into, and it feels stressful, then it's not uncommon to get yourself into that sympathetic state. And so sometimes we kind of need to look at tools that bring you down so we're in a place of learning again. And when we look at how that breathing or even the posturing with stress, the posture with stress and the tightness with breathing can actually affect the expansion of your diaphragm, which again affects your pelvic floor again. Okay, so I do like mentioning this, especially in everyone comes with their own fears and worries and stresses and things like that. And so we talk a lot about what trauma-informed care looks like and what trauma-sensitive classes look like, but a lot of it will come down to kind of knowing how you feel within your own body and how we can impact that towards learning. Okay. Sorry, that got heavy for a sec. Okay, so I wanted to touch on a few things. So we looked at nervous system, we looked at breathing. So that's really important for pelvic floor strengthening. Bladder leakage is always an interesting one. And I bring this up because everyone talks about it and there's a lot of information about if somebody's leaking, then we just give them Kegels. And the reality is it can be really either way. So when we think about pelvic floor strengthening, it makes sense. Well, if something is leaking, maybe it's the valve that's holding everything in that is just not tight or strong enough. Very logical. So if it is because my muscles are either weak all the time, or if they're weak relative to my belly muscles. So if you imagine like the toothpaste tube, if my belly muscles, so my obliques especially, do this, right? If I don't have enough strength on the bottom to hold everything in, then leakage will happen that way. So if I do too much quote unquote core work, right? So if I do like hanging L-sits or leg lifts or a lot of crunches, but I'm not strengthening my pelvic floor at the same time, that leakage is very common. So it's not just leakage of that muscle, but leakage relative to your abdominal muscles. Okay, so your pelvic floor and your belly muscles need to kind of strengthen alongside each other. Okay, so that's one weakness. The other thing that can happen is that if you have a tight pelvic floor, so like short and tight, So what happens is your muscles don't actually get a lot of what we call that excursion. So because your muscles are attached to your tailbone, and your tailbone has quite a bit of movement to it, when your muscles contract, you actually feel that lift. And when they relax, you feel a drop in spread. Okay. What happens with a tight pelvic floor is that they end up a little bit up all the time. And so you never actually get that full relaxation down. So this is why it's really important that when you do these exercises, you relax all the way down and then strengthen all the way up, relax all the way down to make sure that we're not actually doing this and making you tighter every time. Okay. A tight pelvic floor is equally as common as a weak pelvic floor. I see both all the time. And in the pain world, more often than not, it's a short and tight pelvic floor, more often than not. That said, I don't like speaking in generalities, but because I obviously see a certain set of patients, and it's not the statistics of the entire population, but with a tight pelvic floor, if you imagine if my bladder, a nice soft squishy water balloon, if my bladder even has a little bit in it and it's bouncing on top of a trampoline, right? And the trampoline is actually nice and tight, then that's going to cause a lot of some liquid to squeeze out. If my bladder has a little bit in it and my muscles have a bit of give, the likelihood is that I won't have leakage, right? And so with bladder leakage, it can really be weakness or tightness, okay? And that's where hopefully physio comes in and we can help you guide you in that to see what it is exactly. So with tight pelvic floors, we not only work on softening and releasing those muscles, but also look at how you're toileting to begin with. Like I said previously, when you're sitting on the toilet or when you're standing, we want your bladder to actually squeeze the urine out and your muscles to just relax. So you shouldn't feel like you have to push or strain or bear down to empty your bladder. More often than not, it's really just a matter of time and good positioning, right? So what good positioning means is sitting on the toilet, staying nice and tall, not flopping over. In a perfect world, it's having your knees slightly higher than your hips, and then just waiting for muscles to let go and your bladder to do its job. Okay. So we kind of talked about a whole bunch of different things, and I know that was a lot of information, but when you're approaching exercise, think about your posture. So gentle lengthening. It doesn't have to be 100% as tall as you feel like you need to go, because oftentimes in your body that will actually look like chest out, shoulders back, head up, and it's not that extreme at all. It's very much just a lengthening. Okay, like somebody has hooked your head up onto a ceiling and then your pelvis is nice and grounded on the ground. So it's like a gentle lift in between. When you do start doing your strengthening exercises, think of your pelvic floor and your belly muscle. So your lower 1/3 of your belly muscle, which is the lower 1/3 of your transverse abdominis. That's not true. It's a third between your belly button and your pubic bone. So kind of if your belly button's here, pubic bone's here, about a third up is the area that you'll feel when your transverse abdominis activates. Okay. I said a third of the length, and that's not right because your transverse abdominis goes all the way up to your rib cage. So when you are doing an exercise, if I'm doing something as simple as weights in my hand, press up, right? When I'm in this position, I first activate my TA and my pelvic floor at the same time, and then I push up, then I come down, and then I release. So it's a matter of activating those muscles in anticipation of the next move. Because in a perfect environment, perfect, your brain actually activates those muscles when you're thinking about the movement and not when the movement happens. Okay, so it's actually the timing of it. And your TA, your transverse abdominis, and your pelvic floor activate at the same time. Okay? Any questions about that? So they're married to each other and they activate before the movement. Okay? Happy marriage. So ensure that the pelvic floor is strengthening alongside of your core strengthening. So if you are doing planks, if you are doing mountain climbers, right? Even in anything that is staying long within your trunk, anytime you add any sort of weight, you add more movement or repetition, make sure your pelvic floor is staying strong with you. If it's not, let go, stop the exercise, and then reactivate and start again. Okay, so if I'm doing my plank and I'm still, everything looks perfect, but at 30 seconds, I lose my pelvic floor, stop, rest, come back, activate again. Okay, so in that way, I could, instead of doing a minute, I'm doing 30 and 30, and then I sew them together over time. Okay, exhale with effort just talks about decreasing that pressure on your pelvic floor and decreasing any sort of impact on your blood pressure. When you are progressing exercises, consider gravity. So we start gravity eliminated and then add gravity. So when I'm doing, even with TA, when I'm doing pelvic floor and TA, we start in lying and then we actually move it into standing and like single leg stuff and things like that. So static before dynamic for pelvic floor. Pelvic floor is always better if nothing's moving. And then we add movement. So we go lying, sitting, then I practice in standing, and then I get people to do sit to stand or stand to sit. Sit to stand becomes really important for people with symptoms. So losing gas or leakage, especially after post-prostatectomy, that movement of going forward and pulling up. And then when you are doing exercises, especially when we're looking at squats, lunges, things like that, start with a narrow stance before you go wider. And then you are just kind of strengthening your pelvic floor alongside. Because when we start doing pelvic floor strengthening, we usually start with your knees pretty neutral, and then just kind of gradually expand out as your pelvic floor will allow. And then that way we're kind of following your TA with it. So there is a website, pelvicfloorfirst.org.au, that has been around for a really long time. It's a beautiful website. There is a section that just says pelvic floor safe exercises, and it goes through a whole bunch of different options, like specific exercises. So low impact, high impact, different parts of your body for strengthening, and just things to think of for safety with pelvic floor. That's that. And then these are, I didn't do a lot of references because I wanted the ones that I shared to be practical. So Julie Wiebe is the one with the balloon picture. She has some great videos for understanding the piston. She does a lot of work postpartum with runners, especially. Pelvic Floor First is the one with specific guidelines with exercise and training. The Bell Method is this one woman in Toronto who I love. She does a lot of Pilates training postpartum. And she is in touch with Sinead Dufour, who does a lot of research in pelvic floor physio. And so I really trust her guidance with Pilates. Dr. Degasquet is, Bernadette Degasquet is a physician in France who 40 years ago she was also a yoga practitioner, and she did her research in postpartum maternal abdominal health. And so Degasquet is really revered with pelvic physios in the West, in Western Canada. She's come many times to Calgary to train us. And so I use a lot of her methodologies and looking at kind of how our bodies move in yoga, which is basically down to two things: a lot of lengthening through spine, and she always does pelvic floor contraction on exhale. So it's just kind of something that's her methodology. I don't use it exactly the same with everybody, but we really love her. And then Craig Allingham wrote this book, which is the prostate recovery map for post-prostatectomy, pelvic floor, and overall body training. And I love that book. He's Australian, and he has a step-by-step strengthening program, which I find is really useful. And he also has a lot of articles and interviews on his website as well. Okay, and oops, sorry, what did I do? Oh, I see what I did. Anyhow, resume share. Okay, so that is kind of the bulk of what I wanted to share. Hopefully it wasn't too much of me kind of going all over the place, but there are things that I really wanted to touch upon. Does anyone have any questions?